Hi, I'm Scott Carpenter, Director of Customer Education and Medical Safety here at Medtronic ENT. We're putting together a series of videos of best practices. This one is going to focus on patient setup. So first, flat emitter placement. We'd like to put that on the bed at the head. This is a typical setup. It's always good to do this in advance prior to a patient coming in so that you can do a little bit of pre-troubleshooting to make sure you don't run into any problems with the bed itself. One thing you'll want to keep in mind is you do want to put some padding over the emitter. That'll help pad the patient's shoulders, their neck. Most of the time, anesthesia will also use a donut. The patient's head position should be, their forehead should be just north of center of the pad. So as you can see here, there is a cross in the middle. I like to put the forehead just north of that to make sure we have ample volume, EM volume in this area as we're bringing instruments in and out of the field. As far as tracker placement goes, I like to place the tracker as far north on the forehead as possible without getting into the hair. Then we also like to do a loop. And then we'll just loop the cabling here and create a strain relief in case somebody trips over the cable during the procedure. That'll keep this from pulling. I'd like to talk about draping now. With the Stealth, we need to cover a lot of the 3D volume of the patient, so we need a little bit more generous field or access to the patient's anatomy. To do this, just give us below the nose, as far down the side of the head as possible. And as much of the top of the head as possible as well, because we would like to go into the hairline if possible. And then we're going to apply the patient tracker. I recommend trying to place this as high up on the patient's forehead as possible without getting into the hairline. Place the instrument interface box on the side of the bed and plug in your patient tracker. I like to place the patient tracker on the patient after draping for two reasons. One, so that we have access to a lot of the anatomy after the patient tracker is placed, and two, to make sure that the drapes don't interfere at all with the patient tracker, pulling on it, tugging on it, that sort of thing. At this point, we can measure how large our EM field size is. This is important because when we go to verify instruments in and out of the divot, that the size of the field is going to impact our ability to both verify the probes are okay, as well as track while the instruments are inside the nose. So here you can see how high our EM field is. As I raise it above this level, the registration probe details go red, and you can see it red here. So this is actually a very high EM border. This is about how far inferiorly the border is, and this is how high the border is superiorly. One other thing while you have this emitter details window open that's good to note is the geometry area associated with the non-invasive patient tracker. If that number is above 0.5 millimeters, it's going to be very difficult to verify the straight suction because that's representative of the field size shrinking. This is the ideal setup for the Stealth. In certain situations, this may not be possible. For instance, if anesthesia is using a BIS monitor, that takes up a very large portion of the forehead. You may have to find another location for the patient tracker in that instance, so you may have to locate it on the temples of either side. Verifying the straight suction can sometimes be a challenge, especially if there's metal in the field or the suction is physically bent. One thing you can do is look at your emitter details to see what that patient tracker value is and whether or not you have green status with your suction. So here you can see the straight suction is actually outside of the EM field, which is why it's red in both the map and the emitter details. What you should do is troubleshoot to see if there's any metal in the field. Are there instruments laying directly on the emitter? Is there a Mayo stand too close? Many times it's little things like this that may make the difference in getting this to verify or not. And then we'll just loop the cabling here and create a strain